You're live.
Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees special meeting. August 15th, 2023, 3:03 p.m. I will call this meeting to order. Roll call vote.
Mr. Pig? Sorry.
I am here.
Mr. Deal?
Here.
Ms. Sidham? Here. Dr. Henry? Here. Ms. Davis?
Stay with the excuse. On vacation. Mr. Deal, would you please read our mission, vision, and purpose?
Happy to.
Thank you, sir.
Jefferson County Health Department mission is to champion positive health outcomes and behaviors through innovative programs and community engagement. Health Department vision is advancing the health and safety of Jefferson County. And finally, the purpose of the health center, as specified in the revised Missouri state statutes, is Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much, Mr. Deal. Next on the agenda is the approval of the agenda.
I make a motion to approve the agenda as written.
First, is there a second?
I'll second.
First and second, is there any discussion on the motion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Welcome guest. I know we have really one guest, it's Mr. Good, and I believe Jack and Brown's here as well. They're going to be part of the new business down later on, which we're going to get to shortly. Director's report, Ms. Ulmer.
No director's report.
Okay, there's no old business. So the new business, there's two parts. One is act on a recommendation to approve intellectual property contribution agreement. And second one is act on director's recommendation to approve service agreement. I'm presuming all these are going to be kind of meshed in together, correct?
Correct.
Okay, so I guess to proceed, I need a motion on both 1 and 2. So we can discuss these, correct? So if I could have a motion on the point to approve. Act on directors approved of the intellectual property contribution agreement. If I could have a motion on that one, please.
I'll make a motion.
Second.
Okay, first and second, is there any discussion points on that? Not hearing any, all in favor, please say aye.
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 Any opposed? Okay, motion carries, so we'll get to that, but I'm also gonna ask that we make a motion to act on the director's recommendation to approve services agreement as well, so we can discuss these in unison. I have a motion for that.
So moved.
Okay, do I- Second, thank you. Is there any discussion on the point? Not hearing any, all in favor, please say aye.
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 Any opposed? All right, motion carries. So Ms. Ballmer, I guess, who am I handing all this over to?
I was gonna explain it, and then the resolution that you have to adopt both those agreements,
So-
you also further explained it.
Where's yours or whomever needs it?
I want to thank the board for taking the time to come for a special meeting today. We wanted to get the opportunity for you to have time to review materials and to be able to ask questions. As you know, we've been developing an Aspen program for several months, several years. And have worked steadily to get it ingrained within the Jefferson County schools. There's been a lot of interest, a lot of great feedback in terms of our work with the schools, as well as starting to reach out to first responders. As we've made numerous presentations, Aspen has been covered by grants from its foundation up to and including through this current stage. But what we have hit at this point of time is due to the limitations of being only able to serve within our own county, limitation of growth of what Aspen is capable of doing, and sustainability of the program has pretty much reached a limit. What there is an opportunity to do is to allow for Aspen to separate into a 501c3. And for that, in return, Jefferson County Health Department and Jefferson County Schools will retain the license to have, not the license, the services to be able to have for Jefferson County Schools. So that will be as part of the agreement that all of our schools and our recipients will continue to be able to receive those. What it will allow though is it will allow funding outside of the county to help support the program. So as we have been very, very grateful to be able to get numerous grants within the county. As this starts to expand further on, there are outside agencies that have an interest in being able to support this and be able to support the mental health care needs of their children and their communities as well. So what we have done is we have looked into what opportunities there are as far as sustainability of the program, liability. We've put together a potential transition plan to look through how this could happen. But in the end, I think this will greatly benefit not only the youth of the state of Missouri being able to have access to the Aspen program, but then as well, it will also benefit the health agency in terms of being able to continue having access to this vital program, but not carrying the full weight and burden of trying to continue. This is growing exponentially. And so having the ability to be able to enable others to come join in. I'm not sure if I'm saying that's great, but this is a tremendous program. It's a tremendous asset to our youth. And I think that as one of the things that you will see in the documentation is that we've prepared for a Jefferson County specific staff member who will continue the work of this within our county and coordinating services and continuing to update the resource directory and work with all of our contracts. But this will also enable some of Jackie's time. She would basically step back from her role with Jefferson County Health Department and take on a separate role with the overseeing the 501c3 that would be supported then by outside funding in order to be able to continue to allow this to grow. Jackie or Derek, would you like to, that was a very quick synopsis, but.
Yeah, I mean, I think that what you hit on primarily is give the Aspen program the ability to stand on its own. And in that gives it the ability to serve kids in other counties. So as a program here, it didn't have that ability. So the 501c3 has been established and has a board and is willing to accept the IP in exchange for the service agreement. And then Jackie and Kelly would then work on a transition plan on the timing and how that faces in.
So bear in mind that by statute, we are only allowed to provide services to Jefferson County residents because that's where our tax base is. So this would allow the program to be utilized outside of the county. Also would remove the restrictions that are on the program right now because we are not healthcare providers. We are public health. There's a very large distinction that, you know, we have very limited means of providing healthcare to residents. So theoretically, moving forward, if Aspen wanted to go beyond what we have the ability to do in promoting its program and promoting those mental health services, they would have the ability to do that, which I know is a concern of this board, to be able to actually provide the care for Jefferson County residents that by statute we really can't do. This would now enable the program to continue to try to expand and be able to provide those services as well.
And I'm sure you guys have all probably gone through this and checked it, but or any of the original funding sources, would expanding this out of the county be a problem with any of those original funding sources? Does it go against anything that they had as requirements?
From my understanding, no, because a lot of our contracts were state contracts.
Okay.
With the intent that this would grow, it just grew a lot faster than we anticipated. And our most recent funding source through the foundation, it was specifically written as a sustainability grant. It was to help us find a sustainability plan. And part of the sustainability plan was always to grow, not just supporting Jefferson County, but supporting individuals outside of the county. As well as being a 501c3, it enables me to seek additional funding streams that I cannot under the health department. We're limited on what fee structures we can set up in place for limited, what foundations we can apply for, having fundraisers, any of that, versus this would allow a lot more funding streams to be able to support the staffing and what needs to be in place to be able to make Aspen not only sustain but grow.
So is the 501c is gonna be separate from the health department, so it's completely separate.
Correct.
But we will still have an employee that's gonna be hired to manage our role in it, is that?
So the way that we've looked at, and we've included the transition plan just to kind of help outline some of this. The way that would work would be Jackie would step out and would cease being a JCHD employee and would become an employee of Aspen. We would retain a project coordinator who would be paid under contract from Aspen to JCHD. So basically Aspen would still be paying for the funding for this position, but they would be a JCHD employee housed here so that they can ensure the recipient of services in our area.
And so that employee would just be Aspen at JCHD paid for by Aspen.
Correct. So-
501c.
I'm sorry, I didn't mean to interrupt. Yes, and just so that you know, there is precedent for this in terms of our state contracts. So the adult brain injury, children in need with special health care needs, they pay for there are employees that they're paid for through the contracts with the state for those services specifically.
Where will people, what will be their location of work? Here or elsewhere?
Myself right now, that is something we will be exploring. I currently have an office space here. Again, part of the transitional phase would be that I remain here at that point, because there's also other roles that I work closely with the executive director and other staff. So we would want that transitional period to have a smooth process in place with that, as well as some of the logistics with Aspen. So I would request that I can maintain my office space here for a minimum of 4 months, and then we could explore, or I could come back as the 501c3, like we work with other entities, and ask if I could possibly rent office space here. Obviously, we could continue if recommended by the board or executive director to look for space outside of the agency, but during this transitional time period, I would request that we maintain my office space here to help that transition.
And that's 4 months transition period.
That's what I'm recommending and encouraging. It helps with some of the funding, as well as there's things that we need to have in place, like liability insurance, cybersecurity insurance, being able to work with the developers to appropriately transfer assets, as well as I help oversee one of our other internal programs that would help a smooth transition with those pieces.
Basically, it helps to keep going through the end of some of the funding cycles. It connects into the new ones, and then as well, it helps with, Jackie has been very involved with one of our overdose grants. And so helping to transition that individual to a different supervisor and make sure that work is managed.
Do we have any dollar amounts for that estimation?
We are completely covered right now through 2 different funding streams, the Jefferson Foundation Grant and the Jefferson County Community Mental Health Fund Board Grant. We are completely covered as far as salaries, our supplies, everything that has been coming for those, for everything that we do has been covered through those funding streams, and those go through December 31st. Aspen has already been awarded one funding source if we move forward with the transition, and I am working with other funders outside of the county that if today we decide we can move forward, that I will have that funding to sustain myself and the other staff past January 1st.
I'm not sure I heard everything you said, Jackie. So we're covered till January 1st?
Yes, December.
Through the end of this year, because there's some grants that she has, or sustainability grants that we're going to cover the expenses that we're the recipient of,
Right.
not Aspen.
Okay.
So we
I
have
wasn't
to,
sure.
we have to administer kind of the trailing of those grants.
Yeah.
Like my salary is paid through those funding streams. It's not through mill tax at this time.
And how many people have we serviced to date, or how many people are enrolled in the program?
As of today, we had over 200 students whose parents have signed agreements for the upcoming year. And then those that had utilized screening tools for first responders, healthcare workers, and students. As of, I believe yesterday, I apologize, the numbers aren't in front of me, is I want to say 100 and close to 115. We've had over 55 first responders, over 50 students, and over 11 healthcare workers. And those, most of those were through the pilot phases, which is why some of those numbers are small. But the schools that we're currently working with are fully launching this year. So we've been invited to speak at multiple schools to parents. And we've had over 200 agreements already completed by parents as of yesterday.
Now, aren't we already servicing outside of Jefferson County? Didn't we say some Rockwood schools?
We've been working with schools. We are not servicing any children or families at this time, but there are schools in multiple counties outside of Jefferson County that want to move forward with this upcoming school year, which is why we're.
So we
putting this
can't
in.
do that unless we do this year. We
By
can't.
statute, we have to only provide services to county residents.
And no other counties have wanted to step up and do this program either, like St. Louis County or
Well, schools,
Charles County.
They
in
want
other
the
counties,
program, yes.
do what, I'm sorry?
the schools in other counties have inquired about getting the same services that our Jefferson County schools have the ability to do through the health department, but that we can't actually service them because our entity can't provide services outside.
Like we've gone in and worked with, I apologize, we have presented to those schools, we are working with those schools. Our intention is we would like to move forward in the upcoming school year, which is just around the corner, but we need to be able to have the 501c3 status to be able to serve those school districts.
Or are their health departments then not interested in taking on a project or having us been to where their health department can service their counties?
You mean that they would build it from scratch? So it was multiple years for us to design and develop this, and our goal would be that Aspen would continue to grow.
Well, can't they just kind of get in now to the program and have them run it in their own county? I guess it's.
No, because
we
we own the IP,
I see.
right?
Okay.
Like I do all of and my staff do all of the back end work. That means like there's a lot that goes into it. So for us to really be able to expand, we need the 501c3 status to be able to do that and offer those services. I don't believe that there's a way that they could. It's my understanding.
They basically can't take our idea and
Yeah.
duplicate it. We own the idea.
The only other question I always have, of course, is always future cost, future funding from the health department to Aspen. Is there any anticipating that of any sort of any funding future wise?
I have not, there's no anticipation on my part for me asking the health department for any funds. That's why we have sought funds from other sources and they're working with consultants. And one of the pieces is moving forward with possible fee structures, either for some of the clients and users, possibly providers in the area that utilize Aspen on that end. So we are looking at multiple different avenues to sustain where I don't anticipate us requesting any funding come directly from the health department.
The idea would be, correct me if I'm wrong, is that in lieu of allowing us to go forward, it would be in guaranteeing services for Jefferson
Yes.
County.
License, yeah, we would have a license maintained through the life of the agreement, which doesn't have a termination date on it. But waste.
Looking at exhibit A, regarding the hospital, I wasn't sure What it's for, or what?
Actually, that is actually because whenever I typed the resolution, that was on the bottom, I used an old resolution, so I actually need to go line through it, that was in your packet. What you have is exhibit A, the contract to provide services, that's not part of this. That was exhibit A to an old resolution that uses a template to do your new resolution.
Oh,
So the IP contribution assignment agreement was what was approved on new business number 1. And then the services agreement is what was approved on new business number 2.
okay.
Okay, with, student brought it to us, but kind of kicking your child out of the house, so to speak, you're on a little bit, is it not? A little
It's-
difficult, maybe?
It is, but it is an extremely valuable program, and from listening to folks who have used it, from listening to the other providers who have come together around this concept, it is such a valuable service that I don't feel it's right to hold this within our county when others need it and could benefit from it as we have. If there was a way to do it where we were able to be able to provide services outside of the county, that would be something different. That was really the defining piece for me, was just not being able to allow those services or be able to provide those services outside the county.
Can I say one other thing to Rex mentioned? This also does allow us to have our own liability and cybersecurity insurance. So part of what we initially started looking at, when we had a consultant a year ago, got this grant, was looking at how do we protect Aspen, but also how do we protect the health department. So part of what I forgot to mention is a big part of becoming a 501c3 is that we will carry our own liability insurance or cybersecurity insurance. That way, if there is an unfortunate incident, it would not fall back on the health department. It would impact Aspen, and the health department would not have any bearing on that particular incident.
I think the other thing that we need to point out was that this was all done with funding that was brought in through grants. So it's not like the money was taken out of the Jefferson County Health Department funds to build it, and now we're letting it go and be a 501c3.
Aspen was created
completely done.
with grant funding that was specifically given to the health department for the development of the sustainability of the program.
Yeah.
And it could not be funneled back into the general fund to be distributed to any other cost.
Your thoughts?
How are we going to, explain this to the public? And, everybody seems to assume when something like this happens that we're losing a service. Which I don't think we are. But I think we need to explain it so that that's not a concern. Gonna have information on the website, and I know that Aspen, has their own. Is that gonna change as far as?
We've been in the process of updating our website. It will include a lot more frequently asked questions, videos that can be accessed then by responders, healthcare workers, students. The idea was that it could be a place for people to go and get information on the tools itself, as well as access to crisis information. So that is in the process. One of our grants, again, was to help update that website. So that website will, I believe that is part of the request, that the URL will transfer to the 501c3, so we can update and maintain that. And per your request, I'm happy to put any information and worked with our PIO to have any information on that particular website to ensure that the public has a very clear understanding of what our message is.
I think another piece of that is just ensuring as part of our transition plan, we're working with Brian and putting together a communications plan for how we can help the community understand the transition. The reality is that Jefferson County isn't really losing anything. We actually are maintaining our service provision as we are currently. We're just not having to carry the weight.
You're keeping all of the services and you're offloading the risk essentially, and the requirement that you expend staff time in order to try to sustain the program.
And you're also allowing it to grow,
Yes.
to expand out to reach more people, more schools across the state and maybe eventually across the country.
I think it's important, it would be important to tell people, you know, we're not losing any services in this transition, and that this is a way that it could actually improve over time. So.
Thoughts? The other thoughts? Make sure we go through the slicer a couple times a week.
Are we voting on this today?
Think so, isn't there?
Yeah.
Next
So-
procedures, next process.
Correct. So you need to read the resolution and think about the resolution.
Going to presume that the resolution 23-8-15-1 is correct. Our resolution number,
Yes.
right? So I'm reading this cold, so I apologize. At a special meeting of the Board of Trustees of the Jefferson County Health Center held on the 15th day of August 2023, at which a quorum was present, the following resolution was adopted. Whereas Jefferson County Health Center operates as the local public health agency for residents of Jefferson County, Missouri, and has been the recipient of grant funding in order to develop intellectual property needed to create and distribute the Aspen program as a program of the Jefferson County Health Center. And whereas the Aspen program has received many accolades throughout the state of Missouri and inquiries regarding provisions of such services to other Missouri schools. And whereas in furtherance of mental health initiatives for all Missourian residents, Jefferson County Health Center is desirous of allowing the Aspen program to be utilized across the state by its developers. And whereas the creator and developer of the Aspen program has created a 501c3 organization, Aspen Network Incorporated, in order to provide services throughout the state of Missouri. And whereas the Jefferson County Health Center finds that no taxpayer funds have been used to develop the Aspen program as a program of the Jefferson County Health Center, but that all costs have been provided through specific grants for the program. And whereas Jefferson County Health Center desires to transfer the IP developed through grant funds for the creation of the Aspen program to the Aspen Network Incorporated, so that these vital resources may be used to improve mental health access for citizens of the state of Missouri. Wherefore, in consideration of mutual agreements of covenants contained herein and for other consideration, the Jefferson County Health Center hereby approves the services agreement attached here to as Exhibit A. Further, the Jefferson County Health Center hereby approves the intellectual property contribution and assignment agreement attached hereto as Exhibit B Further, the Jefferson County Health Center hereby directs its executive director to prepare a program transition plan to effectuate the transfer of the properties outlined in Exhibit B. Jefferson County Health Center Board of Trustees will resign by me if it is voted on approved. There is a typo on mine now. We need to get it fixed.
Tell me,
Where, at the wherefore, there's two ends. That's
Last
why,
paragraph.
that's why there was this quick little study by me going, why is it two ends? It's in it.
last
On my
paragraph.
copy, it's the last paragraph. So I would like to have that fixed if we could before we're signing it. It's a small thing.
Has the 501c3 already been set up?
Yes, it was set up in the event we are able to transfer, but we would already have that in place.
Okay. So let's say a school when Washington County wants to participate. How would that work? Where would the funding for that come from? Would they pay for that service or?
So right now, what we're looking at is kind of multi-tiered. So some of the counties that have reached out to us are looking at funding streams on a larger spectrum, such as the Children's Fund Board or other entities that would help cover the cost or help with the cost of implementing into multiple schools within their county, multiple departments, things like that. Other counties that maybe only have one or two schools that are interested, we are looking at fee structures, and that will be for working with consultants, and I will obviously work with the 501c3 board of directors and approve as to what those fee structures would look like. It would be based on school size, need, county size, and those types of circumstances, as well as other fee structures would be in place.
So has a board just formed yet?
Yes.
It has, okay. How many folks are on it?
5.
One of the things that just kind of bringing back to, I think this is an opportune time for a situation like this to happen. There is opportunity and interest for sustainability of the program outside of the health department. Whereas within the health department, this has grown at such a large rate that you can see from our meetings and whatnot, this takes a considerable amount of resources and time. And so the larger it gets, the more drawn that, which eventually could pull from our ability to do, to be able to put those optional grants in other places. So it's not to say that it's not a good thing, and I think, and Jackie's done a fantastic job of diversifying her funding sources, but eventually, long term, this is a decision that will need to be made. It's just, I think we're doing it at a time where it would be opportune for both Aspen and for the health department.
I know there's been a concern about the program not actually providing direct services to clients. But I've kind of been checking into that a little bit, and the organization that combined with country. Sorry. My understanding is they have a goal that within sure the timeline, but I believe it's only a few months. They're saying that they will be able to respond to any request for service with no delay. So apparently they're putting a lot more resources into the county. And do we know what other counties they're working in?
I want to say middle of the state, almost from here to the Kansas City area. They work in several counties throughout the state. I know a county they're very active in is St. Charles County. And I know they have several counties they're in throughout the state of Missouri.
One of the benefits that I would like to draw back to with Aspen is the fact that it's ensuring individual students, individual responders are being assessed for the right service at the right time. I think then in some areas we have more providers than and there's probably more openings. Other areas it's very tight and limited. And so ensuring that people are appropriately screened in order to get into the appropriate level of care is extremely important to ensure that for those extremely limited spots, those are being given to the most high need individuals. And so a big benefit of this program is really ensuring that we're taking that off of the school counselors and the teachers and the chiefs and at the different departments where they're sitting on a phone and just calling and trying to find resources for their people. This is collectively coming in with a unified assessment of those individuals and helping them to connect into vetted sources that are waiting for them. So Compass is going to be one of the, because of country, we'll be working with Aspen within this program. So I definitely will be included in their resources.
As it grows, it's in the resource directory, because yes, a large part of Aspen has become screening tools and supports for mental health. But the root system of Aspen has always been having a robust resource directory. And that initial vision was always for Jefferson County, but as everything it has grown. And our Jefferson County residents don't just seek resources in Jefferson County. Sometimes they need resources that are offered outside of our county. So that is a huge part of it as well, that encompasses so much more than just mental health.
So as other areas may get involved, you'd have to expand the resource directory, or would you separate it into specific geographic areas? Or
So the framework for the directory, it has the potential to be in a regional or statewide option. It was designed to grow. It was always designed to grow, just it grew very quickly. So we've already obviously expanded our resources outside of Jefferson County, because our hospitals, a lot of our resources are out of Jefferson County. So we will continue as we expand to continue building up those resources throughout the state of Missouri, possibly even into Illinois and other areas as we identify resources that individuals living in our region need to go to.
So for example, as she was talking about a Jefferson County coordinator doing those services, one of the jobs that they're currently doing is, one, it's going out answering questions. So right now there's all of the back to school registrations. They're out at the registrations, doing parent meetings, talking to students. But then they're also updating and ensuring that the resource directory is up to date with the most current information. If expanding to another area, you can't just take that person who's doing all of that for Jefferson County now and go, oh, and we're just going to add all of this to build on some of this else. But basically the funding needed to be able to expand to St. Charles schools or whatnot would include hiring a person who does that for St. Charles. That would be through Aspen, which is something that we would be able to bring.
And that's part of the sustainability funding plans for us when we work with either putting in place a fee structure in the future when we're looking at other possible funding at this time. It's that, I am one person. There's one program support specialist right now, and it is already an all-encompassing workload, to say the least. As soon as we're done hearing, we need to go do a parent presentation in Hillsborough. So it would be expanding the staffing to be able to support what the program needs immediately, as well as being able to support future growth, which just like Christine Kelly stated, that's just not, I don't see the funding streams in Jefferson County being able to support that.
Who decides whether a school signs up for the service? Their board, does the school board vote? It's taken to the board?
Yes, and I know with the schools that we have worked with thus far, typically our first point of contact is at the superintendent level, and that typically involves an in-depth meeting Or just like you guys have seen demonstrations, they get a full understanding of what Aspen is. Then they can gauge if it's something that they are interested in. And then we present them with an agreement that they typically review with their attorneys first. And then it typically goes to their board of directors, where sometimes I might be invited to be able to respond to questions. And then their board of director approves, and then we are able to work with that particular district. The same for fire departments. Typically, it will go to the chief or chief officers. If it is something they want to move forward with, they review the agreement. It typically goes to their board of directors for their processes and procedures, and then we would work with their staff to train them and implement it within their department.
And then you mentioned a fee schedule. Is there a fee that they pay to come on
At
board?
this time, no, because everything has been granting contract funding. It's just, we have had to start planning for the future. And so part of future planning is exploring at this time with the consultants, if these structures are implemented, is that something that could help sustain the program moving forward?
So it's not a definite that schools
It is
will
not
have
a
to be.
definite at this time, and it is not anything that has been implemented in this time. But that's where becoming a 501c3 would open that as an opportunity for future funding if needed, or determine that's what we need.
And what kind of fee would be, because you mentioned that a couple times, the fee schedule. How much would it cost for a school district to become involved in
We
that?
haven't explored or identified that. That's where we would hire consultants or work with the board of directors for the 501c3 before the structure is implemented and in place. I know other virtual tools, can cost anything from $10,000 for a school of, 5,000 up to 40,000 annually. So it just depends what type
So
of.
they would have to pay for the service
Yeah.
then. So this isn't.
That would have had to been done regardless of whether that stayed under our umbrella.
Yeah.
So we would not have, as an organization, been able to guarantee that those services would have been accessed for free in perpetuity, even to Jefferson County schools. Because once the grants run out, you have to figure out some ways to fund the program.
Yes, I wasn't, okay. I guess I was under the impression once the resources, once this mainframe was built, I didn't know there was gonna be fees involved in it. I thought it would just, here's a resource
The,
for them
the
to
tool
have.
itself, there's not a lot of ongoing funds that go into maintenance. There's some, just like any virtual tool, there's occasional maintenance, occasional updates. Where it comes in places is the staffing. As I said, this has become
Staffing, like what?
like for myself. So for
Okay.
example, I probably put in an estimate of 50 to 60 hours a week, 100%, towards Aspen, and it's everything from training, working with the consultants, helping the program specialist maintain the resources, going out and meeting with the resources firsthand to make sure that they are a vetted resource. Marketing, developing the marketing tools, going in and presenting to boards of directors, just like this evening, I will be the school district presenting to the parents, answering questions, putting together proposals, updating documents, maintaining contracts, working with attorneys. So there's a lot of work on the back end that goes into just keeping it alive and moving forward. Every school that is implemented, every staff member that utilizes it, there's a lot of training involved. So we go in person, provide them training, as well as keep training manuals updated and provide that to them. Attending
There's a cost of making the insurance on the risk, insuring the risk.
Cyber.
Your domain, you're gonna have renewal fees, those things.
accounting, just like maintaining any business, there's that overhead cost. I guess the tool itself and the resource directory, that it could sit there, but then it would not, the whole point of developing it was that it was something that was regularly monitored, vetted, updated. So that way, when individuals went to that resource directory, they would know that it was a trusted source and it was not something that was developed 5 years ago and sat there because there was not the plan in place to keep individuals updating it and working with it.
And how many's on the staff now to get to this
Right
point?
now it is me, and then we had received a grant this past year, so there's a program specialist.
So just
between
two
the
of you
two
then
us,
at this
yes.
point.
And her primary job is really working to, she obviously does a lot of assisting me. She goes out and does some of the trainings, but a lot of it, many of her hours during the week are working to identify those resources, keep them updated, like we have a quarterly, biannual, annual system in place where we have to try to update those resources. Make sure that the information is accurate, phone numbers are accurate, things like that.
Look around, make sure no other discussion point.
We need to make a motion to accept the resolution.
Motion to approve the resolution. Motion to approve the resolution. You already approved the individual agreements, but to approve the resolution itself, it basically explains what the agreements are.
Get a motion to approve the resolution 23-815-1 as I had previously read.
So moved.
Second.
First and second, is there any discussion points on this at this time? Hearing any, for a roll call vote, Ms. Pinkman?
Mr. Pig,
Yes.
Mr. Deal,
Yes.
Ms. Stidham,
No.
Dr. Henry,
Yes.
Motion carried 3-1. Ready?
There's no for the section. You have motion to approve.
I'll make a motion to adjourn.
Motion to adjourn. Is there a second? Is there any discussion point? Not having anything, all in favor, please say aye. Aye.